Way 31 Sydney Martin joins us live in Huntsville. She learned hospital leaders might have to cancel some surgeries, and this is due to a spike in coronavirus cases as hospitals get closer to reaching maximum capacity. Sydney.
Dan Naja here at Huntsville City Hall today. Crestwood Hospital CEO and Huntsville Hospital's CEO, both said that they're still doing outpatient surgeries at their hospital, but they're evaluating doing inpatient surgeries at the hospitals because of the amount of COVID cases right now, the inpatients, and because of sick staff. They said it's making it harder to accommodate to all of these surgeries.
As we've talked about before, we can stretch our physical capacity. The thing we cannot stretch is our staffing capacity. Our COVID is exposing our workforce in healthcare and other essential personnel at home and in their social gatherings.
In Decatur, Morgan, for example, about a third of the patients that they have in the hospital are COVID patients. They are basically full at close to 150 patients, and that's where they are today total. Helen Keller's also, about a third of their patients are COVID patients. The same with Marshall. Athens is down a little bit this week. Knock on wood, they're doing pretty good this week. Their numbers are actually down. Some of our other hospitals are down. Huntsville, Maine, we've got about 100 in that hospital. There's about 600 plus other types of patients there. Many of them, very sick, critically ill, because that's where that care takes place in North Alabama. We have limited inpatient elective surgeries because the hospital beds are basically full. Women and Children's is also basically full. Many other things other than COVID. About a third of the beds in Madison are currently COVID patients. So you can see that theme come up over and over again.
If you see a hospital stop doing some elective or non-emergent type cases, it is because of the concern that we might have to make a decision that would provide somebody less than the care that we want to provide.
Projections, and I hate to mention the projections because they haven't been perfect, but the indicators have been pretty close, is that we will see more inpatients before we actually start coming back down again. Could be as many as 50% more than we're seeing today. Please be careful. Do your best to try to stay safe and help us get through this. We want to be there to help you when you need us. We don't want to be overwhelmed. We're getting close to being overwhelmed if the numbers continue to rise like they are.
Now today, Dr. Karen Landers, Madison County's health officer, said that she works with hospitals throughout the state, and she said that they have surge plans in place to deal with these types of events like this current pandemic. And she said that right now hospitals are just making sure they have those plans in place and ready to go so that they can provide the best care possible for all patients. Live in Huntsville, Sydney Martin, Way 31 News.